Hello, everybody, and welcome to the Physician's Mind podcast. I'm your host, Curtis Wilkerson. I'm an incoming medical student, and I created this show to give successful people a platform to share their experiences and advice to help optimize your journey of lifelong learning and self-improvement in medicine and beyond. Today, I'm joined by my good friend, Sebastian Laguna. Sebastian is a first-year medical student in Arizona, and he's here to share some of his tips and his experiences so far along the journey. Sebastian, thanks for joining me, brother.
Thanks for having me, Curtis.
Absolutely. Sebastian and I are good friends. We were in college together. We went through the pre-med journey, and I think he's going to have some good advice to share. So, Sebas, you want to tell us a little bit about yourself? Where are you in life?
So I'm a first-year medical student at Arizona College of Osteopathic Medicine. It's a DOS program out here in Arizona. We just finished up our second quarter, so just enjoying break. Get to see my good friends again, like yourself, and yeah, so that's pretty much where we're at right now in life.
Awesome. So I always ask the medical students, so far in your journey, what has been the most challenging thing? What was it like adjusting from college to medical school, and how did you successfully navigate those challenges?
Yeah, so I don't think content-wise or conceptually medical school is that difficult. A lot of the concepts you already learned from your MCAT, from undergrad classes, which go into more depth than what we usually go into. The biggest adjustment you have to make is the amount you have to learn in such little time. I think we had a test 1 week into school, and it was over 15 lectures, I want to say, for anatomy. And I think understanding how to pace yourself, how to get everything done is really the biggest adjustment that you and other pre-meds are going to make when you're in that medical journey.
Okay. So making that adjustment, how many hours a day are you studying?
I would say around 6 or 7 now. It started off early. I was around 10, 12, and then you get more adjusted to it. You learn how to be more efficient with your time. I love Anki, and I was spending so much time on it. And then really just becoming more efficient with it. You're better at it the more you learn how to do it, and always be active studying. You should never be doing anything passive when you're studying. You don't have enough hours in the day to do passive learning.
Got to be active, because that's the best way to recall that info, right?
Yep, active recall is the most important thing you can do. Active recall, spaced repetition. I use Pomodoro. It helps me stay focused. That way you don't get into these lows during studying where you're not really understanding any of the information. You're just regurgitating it out, which you can pump and dump, but our ultimate goal is to become physicians and take care of our patients. So I don't like pump and dump method. I think it sells yourself short. Sure, you might get better grades, but once you're studying for boards and you have to bring it back up, that's when it's going to really bite you.
Yeah. So why did you want to be a doctor?
The reason I wanted to be a doctor, I've always loved STEM as a kid, but when I was younger, my grandfather got hospitalized. I was 8 years old, and I remember he had a seizure right in front of me. And that was my biggest thing. Like, oh my God, I saw the doctors come in, take care of him. And that was really like the seed in my head. And then ever since then, just never looked back.
Awesome. Now, when you were applying to school, did you have any challenges getting in? Did you have any doubts? I mean, what
yeah.
some of the things you had to go through?
So applying to medical school was interesting. I only applied DO. For you guys that don't know, there's allopathic schools and osteopathic schools. All my mentors were DOs, and I applied a little late in the cycle, so I didn't even bother going the MD route. But I think the biggest challenge was, yes, I sent in my applications a little later than you're supposed to. I think I sent mine in August, and that pushes you back so much because it's a first come, first serve basis for all the interviews. So I didn't have any interviews going into January. I got 3 interviews after that and got a couple acceptances. Midwestern's 30 minutes from where I live, and I was like, that's what I'm going to do. It's been a great time.
Nice, man. So on the topic of mentorship, who have been some of your biggest role models so far leading up to going to medical school, and now that you're in medical school, who are some of your biggest mentors and why?
So in medicine, my biggest mentor, his name's Dr. Goyle. He works a pain medicine clinic here in Scottsdale. He was really the first physician that I got to meet that brought me in, mentored me. He was really inspiring. I don't want to do anesthesia, but seeing him work, his patients love him. My honors thesis was with him in PRP therapy, and his look on life, how he loves it. He loves medicine. It's not work for him, and that really inspires me and what makes me want to do it.
What's been your favorite class so far?
Anatomy, 100%.
Really?
There's nothing better than a cadaver lab, because that's your first patient that you ever see. It's your greatest patient. They've given you this gift of their body and their life, and that you're going to get to see everything. You're never going to learn as much than you are in an anatomy lab. You get to actually see what we're treating and what we're going to be treating day in and day out.
So what's it like when you walk into that anatomy lab and you see those cadavers? I mean, what goes through your head? They're like, these are bodies of humans.
Yeah, I mean, I don't really look at it that way. Like, yes, these are like you can't dissociate. You have to dissociate from it a little bit, which is a lot easier in first year because when you first start off, they have the heads covered and they'll keep them covered until we start moving into the head and neck, which we did this quarter. But I worked in the funeral home before going to medical school, and I've been used to seeing cadavers. But the way I think about it is that this person has given me this gift from them, and I'm going to treat them with the most respect, most dignity, because this is really how we're going to learn the best. Because you don't understand. Like, when I first started doing the cadaver section, I was like, there's so much adipose tissue, there's so much fascia. Everything is fascia, but it's really cool. You can see individual muscle strands. You can see the grain of the muscle, and it's really interesting. It's an experience that you're going to love, I can tell.
So anatomy's been your favorite class. Are you interested in perhaps a surgical specialty?
Yes, I want to do surgery.
Why do you think that is? What is more appealing to you about the surgical specialties than the other ones?
The reason I gravitate towards surgery would probably be just working with your hands and almost that immediate gratification of, okay, we're going to go in, we're going to take this out, let's do it. But I've always been working with my hands. I've grown up playing sports all my life. I think just being able to be hands-on in that OR is really special, and it's something don't get me wrong, internal med, cardiology, family med, they're all great. Those are a very difficult field. That's the difference. Once you start getting such specialized, like, you start to lose the forest and the trees. But at the same time, we're all a team. We all need each other for us to function as a proper healthcare team.
Yeah, all the specialties need to collaborate and ultimately provide a holistic approach to care. Now, on the topic of a holistic approach, you're a DO student. You're interested in matching into a surgical specialty, typically considered to be more so competitive. So what are you doing to put yourself ahead early on to ensure success later on in this first year? What are some of the steps you've taken?
Yeah, so I would say biggest thing is make sure your grades are right. Obviously, you're not going to want to fail a class or a block. Art, we have classes. We don't do the system-based learning, but getting your grades right. And I think the biggest thing is getting research out there. I've worked with U of A Phoenix on a couple papers right now. Getting to meet or be around people that you know is going to push you and you're going to do good research, form abstracts. That's really the balance. It's balancing between school, which we're getting all our grades on. We have to perform so you can do good in boards, but also getting that research because it's a really important field. It's really important for medicine because we know so little about the body. So the more research we do, the more we can understand and the better we can help our patients.
Well said. All right, so establish a good foundation of the grades, explore some research once you've got the grades squared away, maintain a strong network of friends and mentors to continually expand your knowledge, all tying back into how well you can take care of your patient. Do you have a strong friend group that you've now met in the school?
Yeah, me and a bunch of my friends. So we're all always in the top. Like, I've surrounded myself with some of the smartest people I know, way smarter than me. And I think that's really helpful because before tests, we'll go through all our learning objectives, what we need to know for our test. And we're just teaching each other. It's really a collaboration because we're teaching each other. We'll quiz each other on things just so we understand that everybody understands the concept really well, that you're not just reading it off the slides. We're going really that active recall there when you're told to explain something to us, and we understand the terminology, but we act like we're little kids. So trying to be able to explain it to a 5-year-old is really important in studying and understanding the material, because that's when you become masters, when you can explain it in layman's terms.
Mm-hmm. Absolutely. And I think the term for that I think that's the Feynman technique.
Yeah, it is the Feynman technique.
The Feynman technique, if you truly understand something, you should be able to explain it in a way that a 5-year-old can understand. So what's interesting, Sebastian, is you mentioned you hang around with the smartest people in the room. So why do you think it's important to surround yourself by people who are smarter than you?
You're a product of who you're around. That's a big thing. If you want to be successful, you want to go for these hard specialties, you have to surround yourself with brilliant people and people that are going to push you. And we're equally going to push on each other to help both of us get to our goals that we want in life.
Absolutely. So far, has there been anything particularly challenging for you, and how did you overcome that challenge?
I would say particularly challenging. I think the biggest challenge is recovering from bad tests. I've had a bad test, bad practical, and then it's really easy to get down on yourself. But at the same time, it's your own fault that you didn't understand the material, that you didn't put the work in. So I think being able to lace up your shoes and say, let's get it again. Let's go down. We're going to spend more time in the anatomy lab. We're going to understand all the practical components, be able to identify anything, understand all the concepts of what you're learning to be able to apply it in the test, because you're not going to get first order questions very often. So you have to understand it to a third order degree to really be able to succeed in class.
And what does that mean?
So
It's in third order.
First and third order questions. So first order would be something like, what does this muscle innervate? So something really off the top, like if you saw it on the slide and you just did flashcards all day, you'd be able to just recall it. Versus second, third, and fourth order questions make you read into the question stem, like patient presents with this, this, and that. And then you have to be able to understand what they're talking about and then apply prior knowledge to that as well. You're not going to be able to just see it in the question or see it immediately.
Okay. So one of them is sort of easy to recall. Another one kind of requires a more
comprehensive look at it, because you're gonna the answer or your question stem, you're gonna know what the answer is, but they're gonna be making you explain it to them pretty much.
Okay. So do you think medical school is as hard as people make it out to be?
No.
And why?
I think like I said, time wise, there's not enough hours in the day to study, even as efficient as you can be. But the concepts aren't truly that difficult to master. We've learned a lot more in undergrad classes. I remember physics, I thought was way worse than anything we've learned, because I love biology. I love, especially now that it's all about the human body, I think that's amazing. Going through some of those cell biology classes in undergrad was a little demotivating, learning about plants, but now that we're here. But to answer your question again, I don't think it's too difficult, the classes per se. It's the time commitment and all the things you have to do outside of class, like research, networking, going to conferences, submitting your abstracts. I think that's the biggest challenge, is balancing the two. And of course, still maintaining that GPA and all your credits to a high degree for yourself.
Yeah. Yeah, it seems as though if you want to be successful as a doctor in such a competitive field, you basically have to optimize every day for progress towards your goal, whatever that may be, right? If you want to go into a surgical specialty or you want to do IM somewhere, every day you're waking up and you have that goal in mind, and the opportunities make themselves present, but you have to look for them. And it's like you have to learn to optimize the way you act, the way you network, the way you talk, the way you look for things to be conducive to that goal. Now, what has been the most enjoyable aspect for you? We mentioned some of the most challenging parts. What has been the most enjoyable part of med school now?
I think the most enjoyable is just the people you're around. You're around some of the brightest people in our not school. You're around some of the brightest people in the nation. Like, it's very difficult to get into any medical school. I think just meeting those people, getting to interact with them on a daily basis, because they're pretty much your family. We live in the library together. We see each other every day, and really building those connections with them, we're all getting to learn what we love to know. Like, we all want to be masters of the human mind, body, and spirit, as A.T. Still would say.
Yeah.
But I think understanding or getting to meet all these new people from such different backgrounds who had such a different path to medical school is really, really enjoyable.
Yeah, nice, man. All right, so something interesting about the school you go to is that they operate on a GPA scale, right?
Yes.
So how has that made things different for you? Do you think it's a good thing to have a GPA in med school, or has it made it a little more competitive, perhaps? What are your thoughts?
It's really difficult to say. A lot of schools, as you know, are pass-fail now, but we still get our grades for each class. We're not even on a systems base. We just do, here's your biochem, here's your anatomy, here's your physiology. And usually they line up. Sometimes they don't overlap as well as if you were just doing straight systems based, let's say cardiothoracic, and you're learning the path, the anatomy, the physiology all at one time. But I think for me personally, I like how it works. I think it's good. I think I would do good in systems based as well. But going back to your GPA question, I think the GPA can be good at times and also bad. There's pros and cons with it. I would say the biggest pro is that it forces you, okay, I need to really understand this material, because as we said, if you're trying to go into a high specialty, you're needing 93s, 95s on every test. So being really able to tell yourself, okay, we're going to sit down and know this because I need those grades. And the cons of it is, I would say almost that you're not as much time, like I said, the balancing part between research and the other things outside of just the schoolwork, because you spend a lot of time looking at some random slides to make sure that you understand it, and then you won't get an answer and you're like, oh, why did I spend 3 hours looking at that one slide? But pros and cons, biggest con is like not being able to do as much research. Or, for example, I love to use Anki, and on King is really helpful when you have pass-fail, but we have our own deck that we've made at our school that's just related to all our lectures, which a little more dense than a lot of the Anking areas, but it's good. I think being able to use Anking, that's how I'm going to study for boards, is being able to use Anking, not suspending the cards for at least a couple months. And I think GPA, I like the GPA. I like seeing mine high. So I have class rank, which come out at the end of the year. So we'll see where I land on that.
Nice. Yeah, I think this episode is really going to be geared towards folks who are interested in what medical school is like. And I think you've done a really good job so far talking about what some of the challenges are, what are some of the things you like about it, how you adjusted from college to medical school, how you adjusted to the new course load. You know, we've discussed if it's truly as difficult as people make it out to be, and how you balance it all, and it seems like you're doing well so far. And on the topic of your research, what kind of research are you looking into? What kind of research are you looking into, and how did you get involved in labs? What kind of effort did you take to get into some research?
Yeah, it's really all on yourself, especially at Midwestern, unless you're doing a lot of wet labs. We have a lot of wet labs. We're a health science school, so we have a lot of wet labs from vet. We have vet school, we have ophthalmology, we have dental. So a lot of our researchers are PhDs in their own specific field, and you can get into wet labs pretty easy. I think the hardest part is getting that clinical knowledge, getting into the clinical medicine. And the way I learned it is I went to a club meeting, and one guy was, hey, anybody want to go down to U of A Phoenix with me, talk to the doctors out there, do some research with them? I was like, sure. And that's just blossomed. Working on a couple abstracts. And then with those same group of Midwestern people, I met some M2s that were doing research like, hey, you want to help us finish this research project? And that's a really good group. We worked very hard. We got an abstract submitted to ANS, which is the neurosurgery conference in Boston. Yeah, a lot of it's mainly skull base. We do a lot of epilepsy at U of A Phoenix, but it's a forge your own path. Like if you see something that's cool and you're interested in it, they're going to say, go ahead and let's get working on the paper.
Yeah.
And I also have another lab, Midwestern. You have to reach out to people, and she was doing a lot of TBI research, and I was like, hi, Dr. Thomas, I was really interested in it, and just getting to meet her and work, that's that wet lab setting, but getting to enjoy that, getting just different, you have to get a mix of both. You can't do all clinical research, and you can't do all just wet lab. You have to mix it in, because some are longitudinal studies, some studies you're going to do are going to be longitudinal in nature, versus some you're going to be able to pump them out pretty quickly.
Absolutely. Yeah, I think it illustrates the fact that if you want it, you'll get it. Nobody's really going to do anything for you. So thank you for sharing that, Sebastian. I think it sheds some light on the importance of taking a disciplined initiative towards your goals. In this realm, in particular, research, you got to reach out to those professors. You got to find those connections. You got to go to those meetings, and you just got to put yourself out there. Now, networking. How important has networking been to you in your first year, and what are some of your tips?
Networking, it's hard to network a lot, especially in med student. I think the biggest thing is going to be going to those conferences. I haven't been to a conference yet. I'm going to Boston in April, but just being able to, like you, reach out to people. I've talked to people on Instagram or LinkedIn that are doing specialties that I want to do, and I just reach out, try to get some mentorship, because especially as an osteopathic student, people say, oh, it's impossible. It's not impossible. You just have to really put yourself out there and be able to understand. And then likewise, when you see a DO that's, let's say, in neurosurgery, they want to help other DO students out. And so being able to contact them, especially as a first year, they're like, oh, I wish I would have done this, and that first year. Being able just to meet with them. I think networking is the most important, because we don't know what's coming on, what's going to be next. And being able to talk with somebody with that knowledge is really helpful.
Yeah. And I think a lot of people, what prevents them from taking that first step into saying hi is fear. And I don't know what exactly there is to be afraid of. Perhaps fear of negative judgment, fear of bothering the other person. But personally, I don't think that that's something you should be worried about. If you're wanting to reach, like, I'm a big proponent of, if you see somebody that's doing something you want to do, somebody you want to reach out to, whether it's on Instagram, LinkedIn, you get their email, you give them a call. I'm all about reaching out, because more often than not, people are going to be happy to help you. And if it's no big deal.
Especially as physicians, like, we're all just one big family. We all love taking care of people. We all love the human body. And if they're doing something, they see a young, especially you going into your first year, pre-med or med student, they're going to be, oh, he wants to do he thinks what I do is really cool. And I think it's really cool. So why don't I show him? Why don't I help him? And it's just all a collaborative effort. That's what healthcare is.
Absolutely, man. Absolutely. Yeah. And I mean, for anybody who's listening, If you have somebody you want to reach out to, or if you don't know who to reach out to, just start searching it up. There's a couple episodes, Dr. Chris Fulmer, a graduate of your school, who you got connected with. How?
Yeah, it was before med school even started. I was just going on the Instagram page for Midwestern, and I saw he matched in plastic surgery. I was like, wow, that's really cool, especially as a DO student. I think it was for one of three in the last 3 years they had zero. Yeah, I got to reached out to him. He gave me his number. We got to talk a little bit, and he was just giving me advice like, here's what you're going to want to do. Like, this is how you be competitive for what you want to do in life. And his knowledge has helped me tremendously at Midwestern. I mean, he is the one that told me about the Pomodoro technique, and I live and die by that now.
Oh, yeah, man. I've always loved the Pomodoro. Little 30 minutes on, 5 minutes off,
Yep.
Or whatever your ratio may be.
But no, just having that initiative to reach out. I mean, for me, it's still hard to, especially in person with networking, to be able to put yourself out there in a vulnerable position. But more than often than not, they're not going to be mad at you. They're going to be like, "Oh, really? Like, let's talk to you. Let me do this." They may not be able to help you specifically. Like, I'll preface it with this: you shouldn't, when you're going with networking, you shouldn't go there. I mean, you can have a goal in mind, but you shouldn't go there asking for a handout. You should be like, here's what I can do for you, or just, hey, I would just love to learn more about it. Don't go in with, oh, I need to get this from this person. That's a terrible mindset to have. You go there, you get to learn from people, and then eventually they'll if they like you and you show that you're a good student and a good mentee, they're going to give you opportunities to succeed, whether it's in research, whether it's shadowing, and even if it's a residency, like if you're talking to a resident or the program director, just being a normal person goes a long way.
Yeah. Yes.
Just know, like, this is this is me. This is what I do. And usually people either like you or you don't.
Yep. It's really that simple. Well, and you can never go wrong too by, obviously, like you mentioned, I think that's very important to, rather than ask, what can I get out of this? Ask, how can I be of value to this person? How can I generate a win-win situation, right? Do you want to get some research in? Okay. How can I help this professor or this doctor or whatever generate high-quality research so that he can get more publications and I can get more publications, or whatever it may be? Just being a normal person, being yourself. I think you're right. You hit the nail on the head. Sometimes it boils down to people like you or you don't, but you can never really go wrong with asking questions about people and listening to them.
Yes. First, you have 2 ears, 1 mouth for a reason.
Exactly. And in a world where there's so many people who don't listen, if you can offer that genuine listening ear, that genuine interest, it can go a long way. Do you have any last pieces of advice for maybe somebody who wants to go to medical school, someone who's about to start, tips to success, things they can anticipate?
I would say probably the biggest thing to optimize yourself, especially in medical school, is have routines. Know when you're going to bed. Know, like, okay, I'm going to work out. Take breaks. Like when you're studying, take a break. I know you can't walk much in Michigan, but Arizona, it's perfect. It's perfect outside. So like I've been in the mind gym for 4 hours. It's great to just take a 15-minute walk around, get your mind reset. I think really optimizing your sleep, because I know some people in school that stay up till 2 o'clock. I personally can't do it. I'm more of a morning guy, but I know that, all right, by 9 o'clock, computer's off, we're getting ready to go to sleep and retain that knowledge. You can't really retain knowledge on 2 hours of sleep, as much as people wish they could believe that. It's better to just say, I'm done. Let me get a good night's sleep, make sure I absorb all that information.
And how have you altered your social media habits since starting?
Deleted all of them.
Deleted it. Why?
I think it's just, it's too addicting, first of all, and it just distracts you from really your goal, which is to become the best physician as possible. Sure, like I'll go on it maybe on a weekend or now that we're on our break, but once school's in, just turn it off. It's easier. Once it's out of your sight, you're going to be like, wow, this is so much easier. And you stop losing those 1-2 hours that you're spending on it all day.
Yeah. Great note to end on there, my friend.